Welcome to another episode of the Genetic Genius Podcast. In today's episode, we're joined by Dr. Lara May, an advanced practice clinical pharmacist who specializes in functional medicine and energy medicine. With over a decade of experience in emergency rooms and adult acute care, Dr. Lara has counseled nurses, doctors, patients, and families on medication regimes and maximizing treatment outcomes. However, her own struggle with health issues led her to delve deeper into a world of Reiki, energy medicine, and functional medicine. Her journey has led her from band aid medicine to a passion for empowering women to truly heal themselves on physical, mental, and spiritual levels. As a functional medicine health coach, Dr. Lara has expanded her practice to encompass intuitive healing and functional medicine together with the intention of empowering the healing of her clients on multiple levels to restore their health and happiness. Join us as we delve into Dr. Lara's journey and discover the power of functional medicine in true healing. Hello, everyone, and welcome back to the Genetic Genius Podcast. I'm so excited to have my guest today, Dr. Lara May. Welcome.
Hi, how are you? I'm so happy to be here. Thanks for having me.
Oh, you're so welcome. I'm so excited for our conversation today. We're going to be diving deep into functional medicine and energy medicine, this amazing combination in the work that you do. So I'm really excited for us to dive into that conversation. But before we do, let's have you introduce yourself to our audience so that they can get to know you just a little bit better.
Like you said, Dr. Lara May, I am a board certified clinical pharmacist, advanced practice pharmacist, and I still do some work in allopathic, typical Western medicine in the hospital setting. But a few years ago, I think it was back in 2015, I started really branching out into Reiki and functional medicine, both as a patient at that time. And it had such a profound impact on my life and my healing journey that I decided to take my career in a different direction. And I wanted to start helping people really understand their bodies and that we all have the power to create our own health. And that doesn't necessarily have to involve pharmaceutical medications. And ideally, it shouldn't. And especially, being lucky enough to live in the United States, we really have all the tools at our disposal to create a wonderful, full, and health-filled life. Yeah.
I love that. And that's right in alignment with my own philosophies and a lot of our listeners too, which of course is one of the reasons why you're here today, because you're such in great alignment with our show. And you're tuning in from Truckee, California today, right?
Yes, just North Lake Tahoe. Yeah.
So beautiful there. And how's your snow? Are you guys still having snow? I know you had a crazy year.
Yeah, so it's still in the yard. It's a beautiful sunny spring day today, but it's still there. We probably have about 6 feet of just compacted hanging out in the yard, but it's supposed to be really warm this weekend, so I'm sure we'll lose probably about a foot at least, if not 2, depending how warm it gets.
Wow. This is amazing. You're going to have some really great lake swimming this year. That's for sure. Which will be fun.
And we'll be skiing through 4th of July for sure too.
Oh, which is always amazing. I remember one time when I was visiting that area, we had in our cabin near there, it was a crazy winter. I don't remember, it's been like 15 years ago. And we always had to ski in, and it was up to like over my head when I would put my skis on. It was like, so it was a huge winter. And I feel like that's probably what you guys are having this year now too.
Yes. Yes, it's been a lot. I think even though those of us that moved here for snow, we love it, we're definitely ready for spring.
Like, bring the warm weather. I'll send some of it here your way, because we've already had 80s here. So yes, I'm sending it your way for sure.
Yeah.
So let's talk about some pieces around functional medicine and energy medicine today. But I'd love to first start our conversation with about if you could share how your journey from that traditional piece, which you mentioned a little bit in the beginning about that band-aid medicine where we're suppressing with just a band-aid, and how this kind of really led you into your piece of becoming this functional medicine health coach. Maybe talk us through a little bit of that journey, which you mentioned in the beginning.
So I was diagnosed with IBS at the ripe old age of 23, and I had been suffering with migraines since 18, really. the really debilitating headaches. Like I grew up in the Southeast in East Tennessee, which we talked about a little bit before the show. And within that realm of allergy season and humidity and all that stuff, I had chronic headaches my whole life, but they really escalated into debilitating migraines about the time I started college. And unfortunately, I never really found much relief through
Mm,
allopathic medicine, but it was just one of those things where you were told, this is what we have to offer. If it works, if it
mhm.
doesn't, sorry, you're just gonna have to learn to deal with it essentially. A lot of us are
Sorry.
told that. Yeah,
I
sorry.
know, right? Yeah, sorry, we don't have a solution for you. Go see the people that love to be the detectives, just like us.
Yeah, I will say my GI doc at one point did tell me that he said you could manage it with medication. At that time, there was a new medication on the market that was really expensive that now is considered a mainstay of treatment with IBS and IBD. But he said if you don't want to be on this medication for the rest of your life, you could try managing it things with magnesium and aloe vera juice. And so he did give me a little bit of a natural support there, but two little things in the big wide world of what we now know as our microbiome and our GI tract. It just didn't really seem like much. I took him up on it, but
Right. It's like a
so
little drop in the bucket of
yeah,
healing. You're like a little carrot dangling out there. But magnesium, those are great things that we use all the time. Magnesium, I love it. And I use it myself and recommend it for patients. But yeah, it would, like you're saying, it's not encompassing the whole package, the holistic model,
right.
which was what it kind of led you into,
Yeah,
right?
it's two raindrops into a big wide ocean of
Exactly.
tools. So fast forward till I think I was about 30 between like in my early 30s. And it finally was just getting to the point where I couldn't, everything had escalated. My IBS had turned into chronic heartburn. So just chronic acid reflux. And my migraines were pretty regular. And when they
Mhm.
came on, they were very debilitating. And I do remember one specific night I was working a graveyard shift in the hospital, and a
Mhm.
migraine came on like within the first 3 hours of my 10-hour shift. And I was just laying on the floor of the hospital pharmacy, which was a cold,
Mhm.
hard floor. So in that respect, it felt good just to that little bit of coolness. But at the same time, God, that's disgusting. Because
You're like, I don't
hospitals are
want to
just not clean places. They're not, no matter how hard we try to keep them clean, they're just not clean. And finally just thinking to myself, like, I can't keep doing this because I lived up here in Truckee even at that time. And that's a 70-mile commute one way.
Oh,
So
wow.
yeah, so I still needed to drive home after this and
Mhm.
dealing with this horrible migraine for 10 hours. And it was at that point that I started looking for other areas that I thought might be able to help me. I had tried chiropractic over the years, and chiropractic care was helpful, but it wasn't like preventing them. It
Mm.
wasn't really like slowing the progression of the severity. And so that's when I started looking at acupuncture and functional medicine. And so I found a local practitioner up here who was a chiropractor, but she and I focused really on the migraine aspect and the IBS. She was the first one that said, "Have you ever thought that these two things might be connected?" And
Mm.
I thought, no, my
You're
head's up
like,
here and my stomach's down here. What do you mean?
how could they be communicating?
Because like whether you're a physician or pharmacist or anything that's trained in Western medicine, you're taught that the body is compiled of a system of organs, but you're still taught to think of them as like discrete packages almost within the body. Like, we don't
Mm.
really, we're only now starting to get to the point where, and I would just say this isn't even mainstream in Western medicine, where we think about all of everything being connected. And she suggested that and she didn't do any food testing with me, which is interesting because I guess you don't have to, but it is a faster way to get to some answers. So she just
Mhm,
suggested that
mhm.
I go through an elimination type plan. And so at first I eliminated gluten. And that was also around the time where going gluten free was a fad. So I was like, maybe I'll
Is this
try it.
gonna work?
Yeah,
Right.
I was willing to try anything. So we started there, and after a month, I felt a lot better. Things were definitely starting to change. I could tell the inflammation in my body was starting to dampen down. I had chronic acne flares too, and
Mm.
that helped a little with the different skin flares. And then once we had given that about 3 weeks, then she suggested that I eliminate dairy. And the milk piece was not that difficult, but the cheese piece for me was really challenging. But
Giving
again,
up
I was like,
cheese.
okay, yeah, I'm willing to try anything. And that's really what changed so many things around for me and my body. And so, like, okay, there might be something to this whole like systemic inflammation thing. And of course, being a scientist and being a pharmacist and being in the healthcare field, she would make suggestions. And of course, I would just go research everything. And so, as I was patient, I was also educating myself. Okay, what is functional medicine? What does it mean to
Mhm.
get to the root cause? Oh, inflammation is systemic and it can affect everything. All of these autoimmune symptoms could also
Mhm.
be connected to my microbiome, or my migraines could also be connected to my sleep disturbances or my crazy sleep schedule because I was a shift worker working graveyard for so long. So it was really eye opening. And then parallel with that, about the same time, probably like a year later, but I was still doing them in parallel, I started exploring Reiki and
Mhm.
learning about other ways that I could empower myself to help myself, starting to learn about energy storage in the body and how emotions, experiences, traumas, good experiences, bad experiences, we all store all those things in our body. And depending on like where we store those things might manifest. Having chronic neck pain, people store lots of tension up here. And I had
Mhm.
always had stiffness. And just whenever I went to the chiropractor, this was the area that needed working on. The rest of
Right.
spinal column, not so much. So it was really interesting. And it opened my eyes, interestingly enough, back to everything I learned about physics and all those other things that you have to learn about in order to get in to med school or pharmacy school or nursing school. The fact that matter can neither be created nor destroyed. Everything is made up of energy. We're all made up of atoms. Even inanimate objects are made up of atoms, but those atoms store energy. And so it stands
Mhm.
to reason that that everything has a vibration. So everything that we speak, we sing, we hear, we think, all of those things have vibration. The vibration is a wave. So it
Mhm.
just all of these things started to click for me, and to me just made a lot of sense. And I have been I would say like a spiritual skeptic for most of my life leading up to this, but I think it somehow I was able to sync up the science with the woo woo, and that's sometimes how I refer to it is like farming the woo woo with scientific principles, which I think a lot of the scientific community is finally starting to catch up to things that we've known for so long in the metaphysical realm. So it's really interesting. And yeah, so I just started to practice for myself within myself. But then the
We're
more
the
that I
best
saw, yeah,
guinea
but the more that
pigs.
unfolded to me, the more I was inspired to help as many people as possible and to also help other people that were ready and curious and willing to dive a little deeper and start exploring.
Wow, what a profound story, Dr. Lara. It really, I like the piece how you discussed your own journey, right, through your own illness. And a lot of healers, we have that within us where we actually experience, whether that's the physical or the emotional, the spiritual, they're all connected, of course,
Mhm.
right? But how we experience that within ourselves. And then that's how we want to help our patients in the interim or in the long term. And the piece where you started to really dive and discover your own, you're like, oh, this works. And how can I try this? And then being your own researcher, just that really is, I think, the face of new medicine that we're seeing so many more people. They're just tired of the same, giving the same story when they go into their primary care physicians. We're like, okay, like we mentioned earlier, there's nothing we can do. We don't have an answer. So people are like, okay, I need to research. And listening out there, the listeners tuning in, don't use Google as your researcher. It's not an accurate source of Googling on the wild web as a place for, and that's when you want to tune in to and for answers from Dr. Lara or myself, right? Where we know the studies behind something, which is part of that that like the science meets the quote unquote woo woo, as you mentioned, right? Bringing in the science brain with the energetic brain, and they're working together in this synergy.
Yeah, and I would like to also say that I'm grateful for my background in allopathic medicine and for all the
Mm-hmm.
training that I received over the years, because it helped me dive into the research that I knew. Like, I'm luckily trained in how to read a scientific and be able to tell
Right.
if it's valid, and knowing the different research institutions, and even like looking internationally for very good and valid research. Yeah, that was definitely one of the things, because there this was, I'm trying to think, it was like 2014, 2015 is when all this was unfolding. It was
Mhm.
still very pretty new. I think there were people out there like Dr. Mark Hyman was one of the first physicians that I really started to follow and learn from him about even this concept of functional medicine and what it really
Right.
means and how it can help people.
Yeah, and it's so interesting when you were mentioning earlier about the physics side. And when we're in medical school, we learn so much about the physiology of the body. And from the naturopathic perspective, we learn in a different way than a typical allopath. But when you were talking about that, it reminded me like we all learn the basics of physiology. So when we think about, you were talking about the systems, right? The body
Mhm.
kind of being these organ boxes of systems. But when the basis of science is, we know that everything has to work together from
Right.
physiology. So it can't really be separated.
Right. It truly is an ecosystem. Um,
Exactly. Yeah. It's just like we're a planet with
yeah.
everything fighting to survive on this planet that we call our own.
Yeah. And even in pharmacy school, we learn about you treat this disease state with this drug, but it's going to have side effects in these other parts of the body. So in that respect,
Right.
yes,
Mm,
but it's just interesting. I think still when you look at diagnoses and still treatment, it's still very much
right.
compartmentalized in the
Mhm.
Western medicine approach.
Yeah, we'll continue to see that evolve, I think, over the
I'm
next 10
sure.
years. Even looking back, we'll be like, oh, wow, there was that. We thought that. Yeah.
Yeah.
So you were mentioning too, like the chronic disease piece. And I'd love for us to talk a little bit more about that. Is like, when do you like don't have to be in that chronic? So when are you transitioning from that quote unquote, you've been labeled as a chronic disease, then why is that piece like important for us to really understand and spread to people that we can move out of this chronic disease state? Because I think our society is living in a state of illness, unwellness, right? In chronic disease, we're seeing such a rampage of chronic illness. And so how do we move into, or maybe you can just explain a little bit for our listeners, kind of like what that chronic disease state is from that functional medicine perspective. I think that's a better way to move into that.
Sure. Yeah. So chronic disease or chronic illness, really, if you think about it, it comes down to having chronic inflammation somewhere in your body. Well, that can
Mm-hmm.
show up as chronic migraines. It can show up as IBS or IBD. It can show up as hypertension, diabetes, pre-diabetes, even heartburn. Even if you don't have a diagnosis of IBD, but you have chronic heartburn, that's a form
Mm-hmm.
of inflammation. And anything that is long term. So I would say something within a 30-day container would be considered acute, but
Mm-hmm.
anything after that lasting longer than 30 days really starts to become classified as chronic. So you can see that it really doesn't take long for something to because our bodies want to be in a state of homeostasis, which means balance. And it's always working to keep and maintain a balance. So whether that's pH balance in the body or electrolyte balance, it's a fluid back and forth. And
Mm-hmm.
it's also, you can think of it as a dance. But when we have an onslaught of insults, whether that be environmental, meaning like chemicals, whether we're cleaning
Mm-hmm.
chemicals with our home with chemicals that don't break down or can leave residue or become toxic, or whether you work in an environment where you're surrounded by chemicals. Like I said before, even though we try to keep the hospital as clean as possible, we do that by using really harsh chemicals. And
Bleach.
yeah, and that's not even counting the medicines that we use to treat
Mm.
the patients with. A lot of those come with very serious warnings that some, the people that make the drugs for us, our pharmacy technicians, are constantly exposed to. And then it's in the food that we eat, unfortunately. Even if we're trying to eat as clean as possible, our food supply is just wrought with different types of chemicals, whether it be pesticides or herbicides or hormones or even growth hormones for plants, not even getting into the hormones that we put into the animals that we eventually might
Right.
ingest. We're meat eaters. So
Yeah.
it's just constant. So our body can only do so much. And eventually it just can't keep up as healthy as we all try to be and maintain. And eventually it can develop into chronic disease, chronic inflammation. So that's the basic definition I would say
Mhm.
of.
Yeah, no, that's great, Dr. Lara, because I think it's what people need to understand, that different state, right? When we're moving into just, I don't know, maybe you're mentioning like the neck pain, right? Okay, I had an accident in January, I hurt my body, and I've been healing from that. And I went into, it's been in that chronic state for a few months now. And then I'm finally like moving out of it. And I've been tons of healing for it, right? But I recognized it right away. Okay, this is an acute state, but it moved into chronic because it was such a large piece of healing that needed to happen, right? And then I had to open my toolbox up of, okay, acupuncture, chiropractic, all those tools that need to come in, functional medicine tools, all the pieces that allow our body to then increase that vitality for healing, open up the tube in our body to eliminate things that are no longer needed. Like you said, all those toxins in our environment, and what's that toxic load for us to being able to be healed.
And so much of that starts up here and
Right, in the
in our minds,
brain.
excuse me. Yeah.
In our minds, yes. The ego, the mind, yes, totally. We do have a lot of that are where are we thinking from when it comes to our healing? Are we thinking from our brain, or are we really acknowledging and thinking from our heart about what healing is and what's taking place with that?
Yeah, what are our thoughts? What are our beliefs about even our ability to heal
Mhm.
ourselves?
Right.
Have we been conditioned to give our power away to and say, "Oh,
Mhm.
I can't do anything for my health because I'm not trained in medicine. I have to go to a
Mhm.
doctor to figure it out."
Mhm.
And that's just not true. Yes, we need physicians for some things, but there's so much that we can do for ourselves by just
Mhm.
evaluating our own thinking and our belief system about healing and health.
Oh, that's so true. Yeah. Even recognizing beliefs from childhood and what type of medicine or health our family was using when we were children. That's like the basis of where a lot of us were brought up. And I was lucky enough to live in a household where my family was super into healthy things. I'm sure that was a big piece of why I want to help people be healthy today, is because I know what things can happen when you learn about health, how to take care of yourself, like you're just saying. And when we're talking about using the practice, so we talked a lot about functional medicine and that piece with the chronic illness and understanding that. Now let's move into the intuitive healing piece. So how do you let's talk about, you mentioned the Reiki a little bit, but
Mhm.
how do you use intuitive healing? What's kind of like that piece that you use in your practice? And then how do you meld those together in working with a patient with intuitive healing and functional medicine together? And then like that other component, I don't want to give you too many questions at once, but it is to like addressing the holistic model of the body, like the
Mhm.
physical, the mental, and the spiritual level of healing.
So I would say I still do it by a systems-based approach. So I will do a health history with
Mhm.
a patient, client, and then along the way, I'm getting intuitive hits as they're telling me their story, as they're telling me about their background, as they're telling me what they've tried, what they haven't tried. And I'll ask questions along the way, of course, and
Mm.
we'll come up with a plan. And my plans include food as medicine is the baseline always, supplements if needed, and usually at the beginning stages, I do use supplements as a helpful tool to help the body reestablish that homeostasis faster. Just
Mhm.
like my practitioner did with me, we did an elimination diet. I prefer to use food testing because then we get very specific answers and we get them in a matter of weeks instead of taking up to 3 months to go through a really proper
Right.
elimination sometimes. So
Yeah.
so there's that piece. And then for those clients that are open and interested and want that energy healing piece, then I actually will weave in Reiki and intuitive healing sessions. And some of that can just the aspect of showing up to receive and knowing that there's nothing else that they need to do, even just that can be so healing and really powerful for
Mhm.
patients. Starting to sort of build that faith or maybe open the door to the concept that if I just get still and slow down, my body can heal.
Mhm.
This is something I'm doing for myself. And so it's again like all these little things that we're conditioned and taught about Western life. I have to be doing
Mhm.
something in order for me to
Mhm.
be getting sometimes just actually slowing down. And this is something I even have to remind myself, slow down and take a pause,
Mhm.
allow yourself that time to heal, to receive the energy from source, to allow your angels, your guides, your higher self to come in and help you. And
Mhm.
then it also opens the door for both the client but also the spiritual team to I think hone in on areas that need that extra support. It's
Mhm.
interesting where you might be like manifesting something in your body in a very specific area, but where your spirit team comes in to help you could be a completely different area of your body. Or
Right.
during the session, you might have memories that you haven't had in years. It's something's coming up to be processed that you're like,
Mhm.
oh. So it's really interesting how we learn so much about ourselves through and it's called healing. It's not a cure, but it's a healing journey because
Mhm.
and it's personal for everyone. It's different for everyone too.
Oh, so true. And I liked how you talked about that doing piece because that's like that old kind of like masculine energy that we're really realizing is not serving us as a healing planet anymore. And then bringing in that really softening feminine energy, right? Where it's just we're allowing the healing to happen. And we're talking about the piece where like, if I just work harder, if I just drink that juice in the morning, I'm going to feel better instead of trusting that intuition and just allowing the healing, whether that's through yourself or as a facilitator like yourself, right? Really allowing that piece of healing to start to come in. And I think that's the piece where Western medicine has taught us incorrectly around healing, right? Where if you do, this is going to happen, take this, do that, right? And so we're like, wait, we can still take something, but how do we allow our body to assimilate it from a different perspective, from trusting our intuition? Oh, maybe I really do need that magnesium. How is it going to affect my body? Are the cells going to soak it in? How am I going to react? Is it going to help me emotionally? It's not just like a one pill equals X.
Yeah. Yeah.
Totally.
Yeah.
Yeah. And when you're thinking about incorporating that functional medicine piece, and you talked about the root cause, like that root cause medicine, which you began to discover and what that meant for you when you were in that healing journey. How do you then, you talked a little bit about inflammation, but I'd like you to dive in a little bit more. And how do you address that like root cause from the inflammation perspective? And if you want to even give an example of a case, that's a great way for the audience to understand too, like how do we as functional medicine practitioners address something that is a root, which might be manifesting as a different piece in the body?
Yeah, I actually see this a lot with mental health. So
Mm-hmm.
whether it's sleep disturbances, meaning like you have a hard time getting to sleep or staying asleep, or if you wake up falling back to sleep, or maybe it's a little bit more severe and maybe you have depression or anxiety.
Mm-hmm.
And again, this is new unfolding science and fields at the same time, but we're learning and we're realizing that so much mental health is actually starts in the gut and that our GI tract. And so a lot
Mm-hmm.
of times I will, with my clients that I've helped through different mental health journeys, say, okay, we'll have the supplement piece that will help you, but we're really going to focus on food and what you're eating. And we can do some
Mm-hmm.
neurotransmitter testing, which will give
Mm-hmm.
us an idea of your whole neurotransmitter metabolic pathways. Because that if
Mm-hmm.
we, it's amazing that we can test for that and we can actually get a picture of what's going on in that person's body. So that's one of the other things that I love about functional medicine. It's really precision medicine if we use it as that. Like
Mm,
you can approach functional medicine from a very broad general lens and still have great effect, but there's so many tools we have now that really allow us to hone in and get
mhm,
precise and get very
right.
personalized and specific, which is why I do implement some of the testing within my practice and working with patients too, because it a lot, again, it gets us to the answers faster. And who doesn't love that?
I think the curious mind wanted to figure out like what's really going on with me. And I
Yeah.
think that's where functional medicine, like you said, it does really shine. It allows us to see things through a different microscope when we're looking at lab testing because it's at a different level. That's what when I'm using it with patients, I'm talking to them, especially with hormonal testing and epigenetic testing. What is this going to give this? It's going to give us this like really extreme blueprint of what's going inside your body as if we're looking at that microscope deep in, as opposed to just seeing a basic lab test like a CBC, right? A complete blood count. We're seeing a snapshot of your cell in that moment in time. But when we use a functional medicine test, it really allows us to see more in detail what's going on deeper in the body than just that surface layer.
Yes, and even with neurotransmitters, most of them are made in the gut and then they're transported to wherever they're going to be used in the body. And this is true,
Mhm.
of course, almost all of our hormones. And so it's really important for us to make sure that we have a happy and healthy gut and microbiome. And again, so what does that mean? It's different for everyone, but it
Mhm.
involves taking a look at what are we eating, what are we exposed to, and exposed to in a good way and a bad way. So are we outside in nature? Are we exposed to dirt and flowers and trees and all of these things that actually help us have a wide variety of a healthy microbiome? It's important that we have a healthy balance of microbes within our GI tract because that's what really supports our internal ecosystem.
Oh, yes, it's totally 100%. We have to have that diversity, right? It allows us to have a better immune system too, to be able to
Mhm.
fight off things in our environment, which we're realizing, especially over the past couple of years with the pandemic, that an immune system is super important. If us as practitioners didn't believe that already, it's really shown to the world how important that is. And I think we'll continue to see that evolve as people are realizing how important it is to keep the health of their microbiome in check, so to speak. Yes.
Yeah, so it's a little
Yeah.
bit more complicated than just a probiotic, but there's
Right.
lots of
Yes.
good, fun things that we can do to help support that. So it's not always doom and gloom and
No, the gut is not just doom and gloom for sure. It's much more happy. We want to think about our gut as that happy place, right?
yeah.
And that's why we think about worry from that emotional level from the gut. And let's talk about from the perspective from women, because we have a lot of women that tune into our show. So when you're thinking about giving advice to women who are really looking to restore their health, we're talking about that happiness piece, happiness and through functional medicine, intuitive healing. So how does that approach differ, or does it differ when you're working with women? Do you have much more, is that more of your clientele? I would assume probably yours is like
Mhm.
mine, much more female focused.
Yes, I do have, I think, probably a little bit more skewed to the female side, but I think I have a good balance, but you never, it ebbs and flows too, just like everything else in
Right.
life.
Just
So,
like life.
but I would say it's funny that when women come to me and we do some cycle mapping and we're looking at their full thyroid panel and maybe we're also looking at adrenal hormones and maybe there might be some neurotransmitter mapping in there as well. A lot of it is what is your day like? How do you start
Mhm.
your day? How do you feel throughout your day? And how do you end your day? And you might say, you have all this information. Why does all that matter? Because again, it all starts up here in our heads of what are
Right.
we thinking about it? Let's
Mhm.
say like maybe you're a active mom that has a job and so you wake up but you want to go for a run before work. Okay, great. You're getting exercise in, but dragging yourself out of bed. You're
Mm-hmm.
pumping yourself up full of caffeine. You go for that run. You come back. It's rush to get the kids out the school, out the door to go to
Mm-hmm.
school, all the lunches, the food, all the things.
All the
And
things,
all the
right?
things.
Now, how moms out there, how you doing?
Yeah. And then throughout the rest of your day, it's rush. And
Mm,
then maybe you go pick up the kids after school. It's okay. Now we come home, we make the dinner, we get them in bed. And now what do you do at the end of your day as
mm,
that busy mom? And so again, we need to find a way to create the balance. And so that's what I help a lot of my female clients do too, is intentional conscious scheduling for ourselves to make
mhm.
sure, because a lot of us have this concept of there's not enough time in the day, or I never have enough time. Well, we all have the exact amount of same time every single day. We all have 24 hours in every single day. That
That's
doesn't
true. We
change.
do. That's around quantum time.
So it's how we schedule it and it's how we think about it
Mhm,
that actually changes our experience of it, how we feel about it, and then
mhm,
what we do based on that feeling. And so this is a little bit also where the coaching comes in. Okay, it's important that we make time and schedule an exercise, but it's also important that we're enjoying it when we do it, because our
mhm.
thoughts are really powerful at creating inflammation, just as powerful as they are as creating love and ecstasy and joy in our life. And
Mm.
so if we're not enjoying that workout, then yes, we're probably getting some benefit, but not nearly as much as we are if we're enjoying it. If we're going to
Forcing
do it, let's
ourselves
make
to
the
work
most of
out.
it.
Exactly. Yes, that's a really important piece that you brought up there about really looking from that mindset perspective, the whole scheduling piece. What am I doing in my day? How can I bring in that piece of breathing, or maybe that's a piece of relaxation or the intention. I think that was like kind of the underlying current of what you were talking about too, is just like, how can I live my day from that place of intention instead of maybe go do rush, which in the end then totally wipes out the female mom and all of those moms out there and men. The complete adrenal fatigue that's going to send you right
Yeah.
down the toilet. Not a
Yeah.
good place to end up.
Yeah. We wonder why adrenal and thyroid fatigue is such a thing with for men and women from starts in the
Mhm.
30s and just escalates from there. But yeah, a lot of it is our lifestyle.
Yeah, exactly. Lifestyle
Yeah.
is probably 99%, because we see with epigenetics is everything we do around us affects everything within the inside of our body. That's
Mhm.
another kind of concept. People like, oh, really? Yes, it's
Well, and
true.
lately I've been working with a lot of diabetic patients, and I hear a lot, this family member had it and this family, so that means I'm going to have it too. No, it doesn't.
Mm, no, it
No, no,
doesn't.
no. And what a
No,
wonderful
that's
thing
not how
that
our
is.
body works. Yeah.
It's again, but that's what we've been taught through school. Even if we're not
Mm,
scientists,
mm,
we were taught
mm.
throughout all the years of school that genes are deterministic. And thank goodness we're learning now that's not true for the large majority of our genetic expression. Yeah.
Yeah, and I think what you were talking about with the type 2 diabetes, that's a great place for us to talk a little bit more in depth of. And it's true, if you have that gene in your family, maybe everyone in your family has, maybe let's just pick one side, maybe everyone on your mother's side has diabetes or had diabetes. That doesn't mean you're going to develop it in this moment in time, but you need to look at all of your things in your life. What are the habits that you created in your life that might make
Mhm.
you more prone to develop that type 2 diabetes? Maybe it's the lifestyle, like you mentioned, the nutrition, the sleep, the stress that are going to turn on those specific genes. So yeah, that's a really great point. And when you're talking about type 2 diabetes, let's talk about what the piece of what it is, first of all, for our listeners out there who might not be familiar, because we have two types, right? And then let's talk about prevention and some reversal piece with that from that functional
Mhm.
medicine perspective.
Sure. Okay. So to start with, type 1 versus type 2. Type 1 usually develops as a child. We see it in child or adolescent onset. And
Mhm,
that actually is based on your genetics. Something flips the switch and your pancreas stops making insulin.
mhm.
So your blood sugar
Right.
just goes to the roof because there's no insulin there to help with that uptake of blood sugar. So usually we'll see a child come in the emergency room in diabetic ketoacidosis, DKA, because their pancreas has just stopped working.
Yeah.
So a very simplistic explanation, but
no, that's great. And that would be someone that would be taking insulin, whether in some form, to help with that type 1 diabetes.
Yeah, so they are very straight off the bat insulin dependent. They will have to have insulin in order to maintain a healthy balance in their body in order to survive. Type 2 diabetes, you can be an insulin dependent type 2 diabetic, but that does not make you type 1. So type 2 diabetes is insulin resistance. And this is when, again, your body is pumping out insulin in order to absorb the glucose that you're eating. Essentially, really, it comes down to what we're putting in our body.
Right. Yes, what we're putting in.
But eventually your pancreas can't keep up. So if it goes unchecked, if the inflammation keeps getting worse, then it's like we mentioned earlier that our body just can't keep up with the damage that we're creating. And so you'll eventually, if you don't do anything and you keep eating what we call the standard American diet, which is lots of oxidized fats, lots of omega-6s, lots of fast food, lots of carbs, sugar, dairy.
Not good out there.
All the things that we see commercials for. So essentially any food product
and in all
you see
aisles
for.
of the store.
Yeah, and all the inside aisles.
All the inside aisles with boxes of cereals and cookies and crackers, all that stuff.
Yes, all the microwave dinners and all of those things too. Then you will most likely develop prediabetes, which will develop into type 2 diabetes. You will buy yourself a life of medication and insulin, and then eventually neuropathy, possibly amputation, kidney disease, and blindness.
Not a good road to go down. No. Let's talk about the good side of it. We can reverse it.
Let's talk about all the things we can do to help not go down that road, which is the number one thing is what we put in our body, what we feed ourselves. That is number one. And that is probably the reason I decided to shift my focus since COVID and really focus on type 2 diabetes in my practice, because in the hospital, I just got so frustrated seeing what we feed our patients in the hospital and what we tell them to eat. And it's infuriating to me that we know how proteins and fats and carbs are digested and broken down in the body, and that everything eventually is broken down into glucose. And glucose is what our brain needs to function. Our brain can also, our brain can also function off ketones, but glucose is essentially what our body runs off of. What breaks down into glucose? Protein breaks down into glucose, carbs, all carbs. I don't care if it's a complex carb or a simple carb. It's going to be broken down into glucose. So when I hear someone tell a type 2 diabetic that it's okay if you have a sandwich or it's okay if you have a big bowl of rice or pasta, this is just how much insulin you take to account for those carbs. We could eat lots of the carbs and then you wouldn't need the insulin.
Right, that'd be a much better approach. Yes. Yes.
So even fruit, and this is a conversation that I have with my diabetic patients, is talking about how to still have fruit in the diet, but not overdo it. And type 2 diabetes is reversible and our body can heal itself. And so at the beginning stages, let's say maybe you're on metformin and maybe you're even like taking a little bit of insulin, but you don't have neuropathy yet, you don't have kidney disease yet, and your eyesight's still fine. So your body is not going through what we call, those are the microvascular complications, because they're the tiny little blood vessels in your body. And that inflammation attacks those. And that's why the diabetes attacks all these other places in the body, is because that inflammation is going haywire in those different areas. And again, it just can't keep up with it. And so what we want to do is dampen down the inflammation, lay off of the sugar, lay off of the carbs. It's okay to have more fat. When we have more good fat in the diet, we're more satiated. Our
Hmm.
cells are actually made of what we call a phospholipid bilayer. So they're actually made of fat and cholesterol.
That's right.
So we need good fat and good cholesterol in our body to have healthy, happy cells. And when they're
Hmm.
happy and healthy, they're able to stave off inflammation and even recuperate and heal from that inflammation even better and faster. And so it's really
Right.
just a matter of figuring out the balance. So what's going to be the balance that we're going to like able to step us back from maybe like say like early onset to even like
Hmm.
pre-diabetic, and then from pre-diabetic to completely normal blood glucose levels and normal homeostasis in the body again.
Yes, so true. Thank you for walking us through that whole pathway, because I think it's really important. Diabetes is type 2 specifically is an epidemic, right? We are seeing so many cases and it's not being managed well. And the like real reversal that you talked about is food, nutrition, diet, exercise, water. It's very easy to reverse type 2 diabetes when you have the right tools, when you're taught how to take care of yourself. I think that's the
Mhm.
piece where we're seeing, where, like you said, you're frustrated seeing it, like the food they're giving patients in the hospitals, right? We have
Yeah.
to teach patients how to, they have to relearn how to take care of themselves if they weren't taught it. And then that's like the missing gap. I think we don't see that as doctors, as teachers, doceri. That's where we come in as naturopathic physicians, and the functional medicine piece, right? Where we have to relearn or reteach patients what
Reteach.
it
Yeah.
means to like how to take care of themselves on a daily basis, like you mentioned, lifestyle. But when it comes to diabetes, being able to recognize what a food group is, a lot of people don't even understand what that food group is. Like you mentioned, a simple complex and a complex carb, how that breaks down the body, what types of foods we can eat. Fats are so important, like you mentioned. Oh my God. Yeah. When we had the fad of low fat, no fat diets, what was that, in the 90s? I think it killed
Mhm.
us as women. Like I see so many of my patients that like, oh yeah, I went through that. The hormones are in the toilet, because you
Yeah.
have to have that hormone backbone is cholesterol. And if you don't have a good fat of cholesterol, you're not going to have your hormones. Like you mentioned earlier with the neurotransmitters, they're not going to be there. They're going to
Yeah.
be like turned off.
Yeah. And unfortunately too, I'll have to say that our epidemic of giving everyone a statin
Oh,
because
not good.
oh, let
No.
me just say for the record, statins are not benign. Even if you don't have myopathy or myalgia, which is the muscle pain that can come along
Right.
with them, statins increase your risk for developing diabetes. Statins increase your risk for developing Alzheimer's or dementia. So they
Yep.
are not without risk. And the studies out there that really show a correlation of benefit if you haven't had a cardiac event are very scant. So even
Hmm.
though the guidelines do really push it, and I will say that's so much of Western medicine is focused on guidelines. And as long as you're treating by the guidelines, then if you're hospitalized or you go see your PCP, then the PCP will get reimbursed or the hospital will get reimbursed as long as
Right.
the payers see that you're checking all these boxes. And so,
Right.
unfortunately, statins have come into this environment of, oh, let's just give them one to make sure that they don't develop any of these other. If we're teaching people how to, like you said, like what a food group is and how
Right.
to eat in balance and even how to food combine. So that's one of the things I talk
Exactly.
about my diabetic patients too. It's like you can have blueberries, raspberries. You can even have an apple, which is considered on the high end of glycemic index for fruits. But if you pair it
Hmm.
with an almond butter or a peanut butter, then that and protein will actually be what your body goes after first. So you'll have a more even, you'll still have a little bit of a blood sugar jump, but instead of a spike and a crash, you'll have a little nice, like an egg shape.
Totally.
Like it'll
Yeah, the bell curve.
be a
Instead
rise,
of the
but
bell
it won't
curve,
be,
right? Have the U curve.
yeah,
Right.
yeah,
Yeah.
which
Yeah,
is
that's so true.
better.
Mhm.
Yeah.
Yeah. And we're seeing now that glucose monitors are really becoming a better tool for patients to self-monitor. I think we're going to see that becoming more empowering as well, as a place for people to learn about how the blood sugar works in their body when they can see the real time. Like you just said, okay, I ate an apple and some delicious organic almond butter. What happened to my blood sugar within an hour of that meal? What did I do? Oh yeah, okay, I did have a spike. Maybe next time I'll have half an apple instead of being like, okay, yeah, I'm gonna get on the statin prescription, which I personally work with a lot of patients to help correct the system. Not correct is not a good word, to help them to get back on that optimal health path, right? Instead of bringing on a statin, which it's just not, they're not good. They're just like you said, they're really horrible. I do not approve. Dr. DeLu's stamp of not approval.
No, exactly.
Yes, yeah. We can help the body in so many different ways. And I'll have patients that come to see me and they'll say, oh, my doctor's recommending that I go on a statin. I'm like, okay, let's look at all the pieces, Mr. Smith or Mrs. Smith. Let's look at all the pieces. Give me 90 days. Give me 90 days. Let's do all of these changes in your diet, changes in your exercise program, your water, your sleep, all those pieces we talked about. Then let's run those numbers again and you can talk to your physician. And I would say 99% of the time, those numbers have changed dramatically.
Or did they even look at an oxidized LDL? Like what kind of
Exactly.
cholesterol numbers are they looking at? Because
Right.
again, cholesterol in the body is actually a necessity, but it's the oxidation. So oxidation equals inflammation. And so if your cholesterol is oxidized, then it could be contributing to damage. But if if you haven't even looked at that, then how do you know where you really stand?
A full lipid panel, full cholesterol, all pieces, and you can even do in functional medicine, like we were talking about, you can dive deeper into that, and also from the genetic perspective. So yes, there's a lot of different pieces to look. We got way off the track there with statins. I got all fueled
Sorry,
up.
I brought it up.
No, it's all good. It's all good. It's part of the education. That's why you're here, which is great.
Yeah.
So I know we could talk for a long time about different aspects. I want to just wrap up things today. And so let's talk about what message you'd really like to share with our audience about someone who's interested in pursuing functional medicine as a path to healing and wellness. What are you offering to you have a couple things, a freebie and your call to action. Tell us a little bit about those for our audience today.
So we'll start with the call to action, because that to me has a low barrier to entry, because I offer a free discovery call. And the reason I do this is because I want to hear from you out there. What are you going through? What have you tried? What have you not tried? What are you curious about that you might want to try? What are your questions for me? So I do this because it helps me get an idea for where you are as the patient and how I can help you. It might be that I'm not the right practitioner for you. And, and if that's the case, then I'm not afraid to say that. And I have other colleagues that I can make referrals to depending on what the needs are. But if I can help you, then I definitely want to try. And as long as you, the patient, the client, is willing, then that's the biggest thing, because I can't do the work for you. I am here as a guide and as an educator, but really it's your healing journey. And so you're the one that has to make the changes. You're the ones that have to take the action. And so I can just give you the tools and help guide you along the way. So that's why I offer it's a quick 20-minute call, but it's really just a conversation between the two of us for us to get to know each other and to see if we jive and we want to move forward.
Yeah, that's great. And it's really important because you want to be able to be in alignment with the practitioner that you're working with. So it's really important before you dive deep into the health journey. It's not an overnight thing working with a functional medicine practitioner or a naturopathic physician or other health practitioner. Healing is not a marathon, a sprint, it's a marathon, right? It's going to be a long distance type of activity or exercise program.
Yeah. And that doesn't mean it takes a long time to feel better.
Right.
But
No.
we just want to make sure that you understand it's not a quick fix. It's not a diet pill. It's a process.
Right. Yes.
It took however old you are at this moment, it took that long to develop where you are. And so it's going to take some time to rebalance and bring that homeostasis back in.
Yes, it can. It depends all on your level of action, right? How committed you are to your health program, your practitioner, what level are you ready to take it to? Like some people just can't, like you mentioned, the person that's really busy, that busy mom. What can they do in their life to make changes, right? How committed are they? And that also depends on your rate of healing. Like, what's your commitment level?
Yeah, and
Yeah. And so
sometimes
tell us
that means
about,
slowing down.
yeah, exactly. Yes.
Just
Sometimes
to
that means
reiterate.
taking a break. Yes. Sometimes that means not doing, but receiving and
Yeah.
allowing the healing to take place. Yes. Tell us about your freebie.
So the freebie are 4 healing sessions that I channeled and I recorded. And so they are attuned to the energy of Reiki. And I work with both Asui and angelic Reiki. And I'm also a channel. And so what does that mean? It means that I open up and allow source energy to flow through me for the
Mhm.
benefit of you, the receiver. And each one of them has a little different vibration and a different message, and but they're all really great and fantastic. And again, all you have to do is just lay down and headphones on and chill and receive.
Nice. Sounds wonderful. So we'll put all of those in the show notes, listeners out there, so you'll be able to easily access those to book a free discovery call with Dr. Lara, as well as accessing those freebies. Yay. Thank you so much for those gifts for the audience. That's wonderful.
Yeah, sure.
And one last thing as we're wrapping up today, if you had an unlimited budget, what would you do to make the biggest impact on the planet? Health and welfare of the planet.
I had an unlimited budget. I guess if I had an unlimited budget, that means that I could buy out the ADA and big food.
There you go.
I would completely change all messaging and
Mm,
everything that even that we're telling our kids, and how
mm,
even the food plate is designed. It starts at such a young age of how what we show and teach our children how to eat, but
mm.
then it's just perpetuated through both the school systems and the medical field. And so I would really just do a complete revamp of the education that we give our professionals and that we give
Right.
the public in terms of
Mm,
what we know about food, because we know so much more about food than we're telling people and that we're even like putting into practice. So let's use what we
mhm.
know in the best way possible.
So simple. Ding, I think that's a great one. And I think that education is the key, right? And I think that's not only educating yourself, empowering yourself, but educating your family, your friends, your community, right? That's one little education piece at a time. We'll have the whole planet educated.
Yeah,
But
just like that.
yes, I do like what you said. Yes, exactly. Helping to re-educate. I think it's like education, but it's re-education.
Hmm.
The new population of kids growing up are really in that education piece, are being fed the wrong message about their health. And then we have the older population that has lost their education around health. So it like all
Yeah.
has to be re-educated.
And I truly believe that Western medicine practitioners, they do want to help people. They came
Oh,
into their field
totally.
also to help people. So we just,
Right.
again, have to give them the right tools. And
Yeah,
yeah, they want to see their patients get better, but it's just,
exactly.
they're doing what they're taught to do.
Their scope is just they're acting within their scope of what they've been
Hmm.
trained to do, which is not is great for an emergent situation.
Yeah.
And I think in our chronic disease state, that's where we're seeing that model really is not working.
Yeah.
Yes. Well, thank you so much for joining us today. I loved our conversation about functional medicine, and I learned so much about how that combination of combining functional medicine with that energy intuitive component can really help up-level your health.
Yes. Thank you for having me. This has been a wonderful conversation. I really enjoyed it.
Yay. Thank you so
Yay.
much.